about 1 in 6 people will eventually have a stroke in their lifetime. A stroke, also known as a cerebrovascular accident or brain attack, is a serious medical condition that occurs when blood flow to a part of the brain is interrupted, leading to the death of brain cells. The human brain is highly dependent on a constant supply of oxygen and nutrients delivered by the blood. Blood flow to the brain is regulated by a network of blood vessels, including arteries and veins. The primary arteries supplying blood to the brain are the internal carotid arteries and the vertebral arteries. Vertebral arteries supply the back of the brain with blood. Carotid arteries supply the front of the brain. These arteries branch out into smaller vessels that ensure the entire brain receives adequate blood flow. There are 2 main types of stroke based on their underlying cause. The first and the most common type of stroke is the ischemic stroke, which make up about 85% of stroke cases. The second type is the hemorrhagic stroke, which is less common but often more severe. Ischemic stroke occurs when a blood clot blocks a blood vessel in the brain, leading to a reduction or complete cessation of blood flow to the affected area. A blood clot can form directly inside one of the brain's arteries, typically due to a rupture or tear of a buildup of fat and cholesterol known as plaque. When this type of clot occurs locally, the stroke is thrombotic. A blood clot can also form elsewhere in the body, usually in the heart, and travel to the brain, blocking a smaller artery. This commonly occurs in people with heart rhythm disorders like atrial fibrillation. Atrial fibrillation is a condition in which the upper chambers of the heart does not pump effectively. Therefore, blood becomes stagnant, encouraging blood clots. The blood clot travels to the brain and becomes stuck in a small artery. In this situation, we say the stroke is embolic. The second type of stroke, hemorrhagic stroke, occurs when a blood vessel in the brain bursts, leading to bleeding within or around the brain tissue. Hemorrhagic strokes can be caused by conditions such as high blood pressure, weakened areas of blood vessels that balloon out and eventually burst, abnormal connections between arteries and veins, or a severe blow to the head through accidents. When any of these types of stroke occur, the affected area of the brain can suffer from cell death, leading to loss of function and long-term disability. The severity depends on the location and extent of the brain damage. The acronym FAST is often used to remember the key warning signs of stroke. FAST stands for face drooping, arm weakness, speech difficulty, and time to call 911. One side of the face may droop or become numb. One arm may become weak or numb. The person may not be able to raise both arms evenly. Speech may become slurred, or the person may have difficulty understanding or speaking. Immediate medical attention is crucial. Quick treatment can reduce brain damage and improve outcomes. Several factors increase the likelihood of having a stroke, many of which are controllable. The most common risk factors include high blood pressure, high cholesterol, smoking, diabetes, obesity, excessive alcohol consumption, lack of regular exercise, age, gender, and family history. Stroke can affect anyone at any age. However, the risk increases with age. Men are more likely to suffer from strokes, but women have a higher risk of dying from them. Naturally, African Americans have a higher stroke risk, likely due to a higher prevalence of conditions like hypertension and diabetes in these populations. Stroke treatment depends on the type of stroke, its severity, and how fast the person receives emergency care. In a certain procedure, doctors administer a certain type of medication called the tissue plasminogen activator. This is a medication that dissolves blood clots and restores blood flow to the brain. It is mostly effective if administered within 4 hours of the stroke's onset. There is another treatment procedure of stroke called endovascular thrombectomy. In this procedure, doctors may use a catheter to physically remove the clot from the blocked artery. In people at risk of stroke, doctors often prescribe aspirin or other anticoagulants to reduce the risk of future blood clot formation.